Tony Pinkus is a homeopathic pharmacist. He is Dean of Pharmacy for the Faculty of Homeopathy, grantee of royal warrants of appointment to His Royal Majesty the King. On to you, Tony.
Right. So thank you for listening. This is a very much a whistle-stop tour of homeopathy, and I'm going to try to present the whole therapy in just a very short period of time. So we've already covered the fact that I'm a regular pharmacist, but I got into homeopathy in 1980, and I've been working consistently in that field, either manufacturing remedies, advising, doing acute prescribing, teaching doctors, farmers, veterinary surgeons, and a wide range of the public. So I'm going to talk about the same sort of things that Mike was talking about earlier, the definitions, the origins, how it works, uses and benefits, how it blends with conventional medicine, and I'll just slot in a case study to give you some understanding of it. What is homeopathy? Well, the simplest answer is that it's a natural means of stimulating the patient to cure themselves, and it derives from the word homeopathy, homoios, which is the Greek word for like, resembling, of the same kind, and pathy, which is healing. So you put these two things together, and we have this sense of like cures like, which we have as a principle in our definition. We have this familiar principle, which I'll talk about in a moment. And that's based on the idea of you're finding something in nature that's capable of curing the same thing that it will cure in a healthy person, same symptoms it will cause in a healthy person. And in amongst that, we have the understanding of a direction of cure. How are we doing this? We're looking to the patient, and the patient is showing us by the symptoms that they have the natural way by which their body is trying to heal itself. And what we're looking for in terms of the symptoms are the totality of symptoms, not carving the patient up into different areas and sending them to different therapists, but rather by looking at the totality of symptoms, what we call the symptom picture, and how they're being expressed, both mentally, physically, and emotionally, and also what makes them better or worse. Then we're treating that with a remedy, and a remedy in this case is going to be a bit more defined as we go through this, but it's meaning the choice of a remedy or a medicine and its particular strength, and we use the word potency. So the origins of homeopathy, well, interestingly, it's 230 years old, and it goes beyond that. It was kicked off by a German doctor called Dr. Samuel Hahnemann, who lived between 1755 and 1843. And the reason he did this in the first place was he was very much attached and faithful to his Hippocratic oath, which said, first do no harm. And he was particularly alarmed at the side effects of 18th century medicine, where they're bloodletting and rather strange concoctions which cause huge amounts of side effects. So what happened? Well, he gave up practicing medicine and he started translating books, and these were medical texts. And around about 1790, he was translating the text of a Scottish physician called William Cullen, who had created a pharmacopoeia, it's actually a materia medica of herbal plants. And in amongst that book that he was translating was a monograph for a particular plant called Cinchona officinalis, which is the bark of a Peruvian tree, which the Peruvian Indians were using. They were taking it off, boiling it, and drinking it when they had malaria. And they'd given this information to the Jesuit priest, and it had gotten from the New World to the Old World, and it had ended up in this book. And the difficulty Hahnemann had was that the explanation as to how this worked was wholly unsatisfactory in his eyes, because the chap who'd written the book, Cullen, said, well, the reason it cures malaria is because it's very bitter. And Hahnemann said, well, that doesn't make any sense. I know lots of bitter plants and they don't cure malaria. So how does it work? And homeopathy started with this questioning mind that he had, because he couldn't find anybody to give him the answer. So he got hold of some of this stuff, boiled it up, drank it for 4 days, got horribly sick. And because he was healthy before he started, and he noticed the symptoms very carefully, were all the symptoms of malaria. He had a pounding headache, he had an intermittent fever, and he was sweating, etc. So he recognized that he had procured the symptoms of malaria, which he didn't have before, and he was healthy. And he put these two things together, and he realized that that was a natural phenomenon. In other words, the very same thing that is capable of treating a bunch of symptoms, or actually, sorry, the very same thing that would give you a bunch of symptoms, very specific symptoms if you were healthy, is capable of curing it if you've actually got those symptoms. And that is the fundamental principle of homeopathy. It's not to do with the dilution, that just followed on as a means of making it safer. And he called this the similia principle, similia similibus currentur, which in Latin means let like cure like. And he thought, well, hang on a minute, is this just a one-off, or is this applied generally? So he got amongst himself a bunch of students who were willing to practice using lots of other poisonous substances that were around. And he found that, you know, you diluted these things a bit so you didn't kill yourself. And they did what were the early provings, which were basically the early clinical trials. And they showed that with hundreds of different substances, they all had a clinical picture, which had its ramifications in terms of physical, mental, and emotional illness. But most importantly, physical illness accompanied by lots of information about what makes the person feel better or worse in a very, very specific and individual way. And homeopathy is a very bespoke medicine. I should leave you with that idea. So all this information was collated into a massive book called a Materia Medica, and each of these different substances had a monograph, and you had to access all this information, which you did with a very fancy index called a repertory. And these books are still in use today by homeopaths around the world. And now, of course, with the aid of computers, you can rapidly access this information much more quickly. Hahnemann printed all this information down. He put practice and principles of homeopathy into this seminal text that's called the Organon of Medicine. And it's basically a thick book which is still used to train homeopaths around the world. And it divides itself into three sections: the principles of homeopathy, what's it about, how does it work, how to practice it as if you're a practitioner, and also how to make the remedies, which is a part I'm most interested in. The remedies that he used, and this is important to understand, were originally all material doses of the animal, mineral, and vegetable substances that he acquired and was using as remedies. So they started life as material forms. The difficulty he had, of course, was that these caused nasty side effects. And with his principle, his Hippocratic oath that said, first do no harm, he had to find a way of administering to the patient in which they wouldn't compromise the person who was already sick. And so he diluted them. And then we come to the most paradoxical part, which is the fact that he noticed that he diluted them in a particular way. In other words, instead of just diluting them with a bit of water, he found that if he diluted them and shook them very vigorously at each stage of dilution, he could remove the side effects but retain the therapeutic effects. And the paradoxical part was that the more he diluted and the more he shook them and this process, the stronger they got. This is the part of homeopathy that everybody focuses on as an implausibility. But in actual fact, it's an add-on component that is simply there to remove the side effects, but it's a very useful one. So how does it work? Well, when we look at how homeopathy works by comparison to conventional medicine, allopathy or conventional medicine treats the person by removing the symptoms. The symptoms are looked at as something nasty to be removed. In case of homeopathy, the fundamental difference is that we're looking at the symptoms that the person has as the best their body can do in order to get better. In other words, it's indicating this natural path to cure, which is where I was talking about the direction of cure. So what the homeopath does is they first take the case, as it's called, and they establish a diagnosis like a conventional practitioner or medic, and they get the full symptom picture. In other words, everything that's going on with the person, all the physical, the mental, the emotional symptoms, together with what makes them better or worse, which are called modalities. And in amongst this, we're including where and when these symptoms occur, what they feel like, what sides of the body they're on, as well as the aggravation or the amelioration. In other words, when they're getting better or worse, what makes them better. And maybe it's a particular time of the day, maybe it's a particular way that they're lying on their side, or whether they're standing or walking. All of these things are particularly useful. And even more so, the odd things. For example, the practitioner is going to pay particular attention to anything strange or rare or peculiar that the patient says, I noticed that at 3 o'clock in the morning, I get this pain in my left leg, or I notice that the symptoms come on just after I've eaten, or when I lie on my left side. These are all the very significant comments that a homeopath is tuned into listening to that allow them to go to one remedy or another. So the homeopath is going to use all this data to select the closest remedy of fit. And then they'll give this remedy in homeopathic form, in other words, in a highly diluted form, assess the patient response, and review the case after a period of time. Now, to give you some sense of relating to that in your own life, if you've never had any contact with homeopathy, I just invite you to consider what happens when, for example, you cut up an onion. If I told you to go into your kitchen, shut all the doors and the windows, and take the strongest onion you could get and start cutting it up, you would start to get the symptoms. And this would be very much like a proving that Hahnemann was describing. You would recognize symptoms like burning eyes, stinging eyes, conjunctivitis, for example. And then you'd start having the water streaming down your cheek. But then you would notice very particular things like the fact that the tears that are running down your cheek are not burning, they're bland. But on the other hand, you're sneezing, your nose is running, and the discharge running down your nose is actually burning your upper lip. So it's all this detail that's critical. And these are what appear in the Materia Medica, or the monograph in the Materia Medica, for this remedy, which is actually used for the treatment of colds and also for hay fever. As you can see, the symptoms in this case, when you're cutting up an onion, you'll find are all better from fresh air. So that's a modality. So you can see how, even in a very simple form, this fits together. How does it work? Going into a bit more detail, the aim of the process is to stimulate the existing natural curative response by the precise choice of a remedy which fits the symptom picture, and it's given in an appropriate dose to suit the patient precisely. In other words, it's a very bespoke approach, taking consideration of how the patient is actually manifesting those symptoms. So the patient in this reality is considered as being stuck. In other words, they've come up to you with a series of symptoms, and they're needing to be prodded in a very accurate way along a very natural direction of cure, which is the natural direction which their body is taking to cure itself. And that's what we call the symptom picture. Now, the key factor that Hahnemann revealed was that an external agent, in this case the remedy, is more capable of eliciting this gentle prod than the prevailing internal process. In other words, they're stuck and they need to have a shove. So the remedy in this case is providing that shove. It's what we call the primary response. It stimulates the body and it gives them a shove. And once that's done, we remove it. We don't need it anymore. The patient, and in this case, the patient comes back with an equal and opposite response, which we call the secondary or healing response. And that is the thing that cures them. In other words, we're getting them over the hump of where they're blocked, and we're actually initiating a response from them, which is curative. Uses and benefits. Well, there's a very wide spectrum of disease that's covered by homeopathy. And we, in the field of homeopathy, often use this amusing acronym called TEETH. Tried everything else, try homeopathy. So it's used for both a chronic and acute disease of a very wide spectrum. There have been 5 homeopathic hospitals that were spread across the UK. Sadly, they're no longer practicing within the NHS, but there are thousands of homeopaths around the country, and they can all be found from a site which is called findahomeopath.org. But no side effects or residues is one of the most important things. And when I'm working with, for example, farmers who don't want to have drugs to put into the food chain or compromises their productivity, they're very keen on using homeopathy because they can give their remedies to animals for treating calves or with pneumonia or cattle with mastitis. without the fear of contaminating the milk reservoir. More commonly in the field of humans, pregnancy, childbirth, because there are no side effects, there's nothing to concern herself about the side effects of remedies within infants or during pregnancy. More commonly, you see things with upper respiratory tract infections, urinary tract infections, rheumatic and arthritic complaints, but also, as I mentioned, emotional, mental, and physical conditions, because we're not separating the person into component parts. We're looking at the mental and physical components of the remedies. So injuries, inflammations, infections are one. In 6,544 patients, 70% of them treated at the Bristol Homeopathic Hospital for a wide range of chronic medical conditions, such as the ones above, reported positive health. In a similar study, an outpatient study at the Glasgow Homeopathic Hospital, there was an 80% positive patient approval rating. So can it be used with conventional medicine? Yes, it can. We can look at homeopathy either as being complementary or alternative. It can be used alongside conventional medicine, especially where the patient needs to stay on their conventional medicine, either for short-term or long-term, or it can be used alone as an alternative. And then there's this other interesting aspect in which homeopathy can be used to antidote the ill effects of conventional treatment. This is something called iatrogenic disease, where a patient might go from one remedy to another remedy to another remedy, and they're having to have lots of prescription medication because of the side effects of one having to be used to be treated by another. You can do this far more cheaply and far more effectively with homeopathy, and that's an area we call tautopathy. Case studies. I'm only going to show you one very brief case study because thousands I could show you, but this is one, ironically, with sheep, and this is a disease that we have with shepherds. It's called off. It's a viral infection, it's a herpes-like disease, and it afflicts newborn lambs. It causes very sore, painful pustules around the mouth and on the ears udders, which means that it compromises the lamb's ability to suckle, and it leads to fatalities in the flock due to starvation. And the following pictures just show you its treatment with homeopathy. So the first picture shows you a typical case where this lamb has this nasty pustule, wet, nasty pustule around its mouth, which means it can't feed from its mum. And the remedy was given, the homeopathic remedy, which was actually made from the organism causing the infection, the virus causing it, was then given between pictures 2A and 2B. And you can see that even within that space of 4 days, the viral infection has stopped and dried up. And then 2 weeks later, it's completely cured and the hair's grown on after it. So you can see that it's not just for mild conditions. This is a life-threatening condition that would otherwise compromise the animal's life. So in terms of research, there's often this thing that people say, well, there's no evidence to support it. But when we do look at the evidence, and here's 157 randomized controlled trials of homeopathy by the end of 2022, compared with a larger number of systematic reviews of conventional medicine. And the interesting thing that I draw your attention to is that the same pictures is seen. We're seeing the same degree of success in positive outcome, 43% in homeopathy as opposed to 45% in conventional medicine. And yet in homeopathy, we're seeing only 3% negative studies as opposed to 10% in conventional medicine. So it would be incorrect to assume that there's no evidence to support homeopathy, because there's a lot. Finally, a summary. Well, what is homeopathy? It's a therapy based on stimulating the patient to cure themselves. Like cures like. That's the most important thing that people ignore when they talk about the fact that it couldn't work because it's too dilute. That's not the principle of homeopathy. The principle, as I've shown you, is it's employing the patient's global or total symptom picture to define their natural direction of cure. This means the sum total of their symptoms, the mental, emotional, physical, with a knowledge about how these are affected by all sorts of factors, which are what we call the modalities. And then we select a remedy which exactly matches this picture, having been determined to promote the very same symptom picture of their condition in a healthy person. And this is given in a highly diluted form so as to minimize any side effects. So you can see that this plausibility argument that might be shoved at you is of highly diluted medicine having no action is erroneous and a misunderstanding of homeopathy. I hope that gives you a bit of a whistle-stop tour. The Faculty of Homeopathy is my organization, and you'll see more information about homeopathy on the email website. Thank you very much. And if you have any questions, do ask.
Lovely. So just a couple of questions before we move over to the next speaker. As with any complementary therapies, there are many misconceptions that people may have. And with homeopathy, are there a couple of the common ones that in your experience you've kind of come across? And how do you tackle that with your clients?
Sorry, are there common, just can you repeat?
Misconceptions.
I think the biggest misconception that people have, that's probably the deterrent for people coming into homeopathy, is they think, well, it can't possibly work because there's nothing in it. That was probably the area which I would draw everybody's attention to today, because I'm showing you that isn't anything to do with homeopathy. That's just a quick fix to get you over the side effects. There's lots and lots of areas where people come into homeopathy, mostly through recommendation of friends or family members who've had contact with good experience of homeopathic remedy. Most of the cases I'm dealing with are, I would say 40% of them are animal cases. People either going to a homeopathic vet, or they're even, coming to us with cats and dogs and sheep and goats or cows, because it's the same principle that we're using across all species. If your dog falls over, or your cow falls over, or your Auntie Sadie falls over, we still give them the same remedy. So it's common across all life forms. And there's a very wide range of both prevention and treatment that we use with homeopathy, which makes it a very cheap and effective form of therapy.
Thank you very much.
So I've got another question. It's more finding out about whether there are any potential interactions between homeopathy and conventional medicine that patients should be aware of.
Largely not, because there's nothing material in the homeopathic remedy, and so there's no side effects, which makes it fairly easy to use it alongside conventional medicine. And we do this all the time, so there isn't really an issue. There are some concerns that people have about taking iron before an operation. I think the jury's out on that, because there's no evidence to suspect that it does cause a problem. And I've been giving it to people who are having general surgery for about 40 years and finding that their recovery rate is much faster. So there's a good complementarity with the conventional medicine.
Fantastic. Well, thank you very much, Tony. That was an incredibly insightful talk.